Conversion therapy is the pseudoscientific practice of trying to change an individual's sexual orientation using psychological or spiritual interventions. There is virtually no reliable evidence that sexuality can be controlled or changed, and medical bodies warn that conversion therapy practices are ineffective and potentially seriously harmful. Nevertheless, advocates and proponents do provide anecdotal reports of so-called ex-gays who claim some degree of success in becoming heterosexual. Medical, scientific, and government organizations in the United States and Britain have expressed concern over conversion therapy and consider it potentially harmful. The American Psychiatric Association opposes psychiatric treatment based upon the assumption that homosexuality per se is a mental disorder, or based upon the a priori assumption that a patient should change his/her sexual homosexual orientation, and describes attempts to change sexual orientation by practitioners as unethical. It also states that debates over the integration of gay and lesbian people have obscured science by calling into question the motives and even the character of individuals on both sides of the issue, and that the advancement of conversion therapy may cause social harm by disseminating unscientific views about sexual orientation. United States Surgeon General David Satcher in 2001 issued a report stating that there is no valid scientific evidence that sexual orientation can be changed. The highest profile advocates of conversion therapy today tend to be fundamentalist Christian groups and other organizations which use a religious justification for the therapy rather than speaking of homosexuality as a disease. The main organization advocating secular forms of conversion therapy is the National Association for Research and Therapy of Homosexuality, NARTH, which often partners with religious groups. Techniques used in conversion therapy prior to 1981 in the United States and Western Europe included ice-pick lobotomies, chemical castration with hormonal treatment, aversive treatments, such as the application of electric shock to the hands and/or genitals, nausea-inducing drugs, administered simultaneously with the presentation of homoerotic stimuli, and masturbatory reconditioning. More recent clinical techniques used in the United States have been limited to counseling, visualization, social skills training, psychoanalytic therapy, and spiritual interventions such as prayer and group support and pressure, though there are some reports of aversive treatments through unlicensed practice as late as the 1990s. The term reparative therapy has been used as a synonym for conversion therapy in general, but it has been argued that strictly speaking it refers to a specific kind of therapy associated with the psychologists Elizabeth Moberly and Joseph Nicolosi. History. The history of conversion therapy can be divided broadly into three periods: an early Freudian period, a period of mainstream approval of conversion therapy, when the mental health establishment became the primary superintendent of sexuality, and a post-Stonewall period where the mainstream medical profession disavowed conversion therapy. During the earliest parts of psychoanalytic history, analysts granted that homosexuality was non-pathological in certain cases, and the ethical question of whether it ought to be changed was discussed. By the 1920s, analysts assumed that homosexuality was pathological and that attempts to treat it were appropriate, although psychoanalytic opinion about changing homosexuality was largely pessimistic. Those forms of homosexuality that were considered perversions were usually held to be uncurable. Analysts' tolerant statements about homosexuality arose from recognition of the difficulty of achieving change. Beginning in the 1930s and continuing for roughly 20 years, major changes occurred in how analysts viewed homosexuality, which involved a shift in the rhetoric of analysts, some of whom felt free to ridicule and abuse their gay patients. Europe. Sigmund Freud. Sigmund Freud was a physician and the founder of psychoanalysis. Freud stated that homosexuality could sometimes be removed through hypnotic suggestion, and was influenced by Eugen Stinich, a Viennese endocrinologist who transplanted testicles from straight men into gay men in attempts to change their sexual orientation, stating that his research had thrown a strong light on the organic determinants of homoeroticism. Freud cautioned that Stinich's operations would not necessarily make possible a therapy that could be generally applied, arguing that such transplant procedures would be effective in changing homosexuality in men only in cases in which it was strongly associated with physical characteristics typical of women, and that probably no similar therapy could be applied to lesbianism. Stinich's method was doomed to failure because the immune system rejects transplanted glands, and was eventually exposed as ineffective and often harmful. Freud's main discussion of female homosexuality was the 1920 paper The Psychogenesis of a Case of Homosexuality in a Woman, which described his analysis of a young woman who had entered therapy because her parents were concerned that she was a lesbian. Her father wanted this condition changed. In Freud's view, the prognosis was unfavorable because of the circumstances under which she entered therapy, and because homosexuality was not an illness or neurotic conflict. Freud wrote that changing homosexuality was difficult and possible only under unusually favorable conditions, observing that in general to undertake to convert a fully developed homosexual into a heterosexual does not offer much more prospect of success than the reverse. Success meant making heterosexual feeling possible, not eliminating homosexual feelings. Gay people could seldom be convinced that heterosexual sex would provide them with the same pleasure they derived from homosexual sex. Patients often wanted to become heterosexual for reasons Freud considered superficial, including fear of social disapproval, an insufficient motive for change. Some might have no real desire to become heterosexual, seeking treatment only to convince themselves that they had done everything possible to change, leaving them free to return to homosexuality after the failure they expected. In 1935, a mother asked Freud to treat her son. Freud replied in a letter that later became famous. "I gather from your letter that your son is a homosexual. It is nothing to be ashamed of, no vice, no degradation, it cannot be classified as an illness, we consider it to be a variation of the sexual function, produced by a certain arrest of sexual development. By asking me if I can help, you mean, I suppose, if I can abolish homosexuality and make normal heterosexuality take its place. The answer is, in a general way we cannot promise to achieve it. In a certain number of cases we succeed in developing the blighted germs of heterosexual tendencies, which are present in every homosexual. In the majority of cases it is no more possible. It is a question of the quality and the age of the individual. The result of treatment cannot be predicted." Sándor Ferengi. Sándor Ferengi was an influential psychoanalyst. Ferengi hoped to cure some kinds of homosexuality completely, but was content in practice with reducing what he considered gay men's hostility to women, along with the urgency of their homosexual desires, and with helping them to become attracted to and potent with women. In his view, a gay man who was confused about his sexual identity and felt himself to be a woman with the wish to be loved by a man was not a promising candidate for cure. Ferengi believed that complete cures of homosexuality might become possible in the future when psychoanalytic technique had been improved. Melanie Klein was a pupil of Ferengi. Anna Freud. Daughter of Sigmund Freud, Anna Freud became an influential psychoanalytic theorist in the UK. Anna Freud reported the successful treatment of homosexuals as neurotics in a series of unpublished lectures. In 1949 she published some clinical remarks concerning the treatment of cases of male homosexuality in the International